I'm Andrea Klein-Thomas, reporter with CBS New York, here at the 5th International Vatican Conference. We are joined now by Dr. Ron DePinho. Thank you so much for being here.
Pleasure.
A lot of medical conferences don't oftentimes look into all of the dimensions, the whole patient, the whole person. Why is it so important that this conference does just that?
I think the uniqueness of this conference is that it brings together the collective wisdom and capabilities of diverse stakeholders. Up to half of all diseases can be prevented with knowledge that we have in hand today, but knowledge exists within silos. And what this very special conference does is it brings together different groups, an uncommon table of policymakers, of service providers, of educators, that could really bring together the collective capabilities needed to bridge the gap between knowing and doing with respect to disease prevention.
What are some of the exciting new developments with cancer prevention and diagnosis?
Well, we're experiencing a true revolution. This is the golden age of cancer research. So one of the most important advances is the advent of vaccines that can prevent cancer, such as the HPV vaccine, which can prevent cervical and throat cancers. There are exciting advances in the area of policy, where we've now raised the age of tobacco purchase to 21, which is going to have a profound impact on numbers of lives saved, as well as economics, many billions of dollars. And then it's similarly policies in the area of tanning beds, where children who use tanning beds have a dramatic increase in the incidence of cancer later in life. So those are some just basic strategies. But on the diagnosis side, I'd say by the end of this decade, we will all have access to a simple and inexpensive blood test that can detect the major cancers at the most earliest curable stages.
Wow. That's mind-blowing. That's mind-blowing because everybody's been touched by cancer in some way. You were saying that the seeds of disease are planted during childhood. So what are some of the preventative measures that should be taken, and how should they be prioritized?
I would say that number one would be to really implement very, very simple, effective strategies, such as vaccinating all 11-year-olds with the HPV vaccine. Secondly, the biggest health problem that we have globally is tobacco. And most adult smokers start as children. And so doing everything that we can do for tobacco prevention is critical. Also, sun protection. So the child's skin is very vulnerable to damage, UV damage from the sun. So it's particularly important that we protect children from excessive sun exposure. And then lastly, obesity, which is a major instigator of cancer, really needs to be controlled. And the opportunity to do that really begins during childhood. So things like avoiding sugary drinks and also exercising regularly each day, I think are active things that we could be doing to protect the future health and well-being of our children.
And how do we make treatments, especially the novel treatments, more accessible?
I think that this is going to continue to be an issue because it's a matter of resources. So governments have to have the will to be able to supply these transformative treatments that are curing patients with cancer, so that we've really bridged the gap, the opportunity gap to the underserved communities. But I think an important game changer is going to come in the area of technology. So the ability to bring really world-class knowledge and information using artificial intelligence, machine learning, telemedicine technologies, so that we can bring world-class expertise into communities, particularly rural communities, where the delta between the more advanced medical centers and major cities, it can be very, very significant. So I think that technology is going to be an important contributor going forward. And we're seeing that now as a result of the pandemic.
All right, Dr. DePinho, we thank you so much for all the work you're doing and for your time today.
Thank you very much.